One of our biggest commitments is to enhance the well-being of individuals, and by enhancing well-being, we don't only mean just that one person or that family that walks in with us, but also, again, the environment or where they're living. Because one of the common beliefs we have is if we just work with one individual, but we don't fix where they're at, or the situation, or their economy, or their lack of jobs, or whatever it is that's affecting them, then we're just returning the individual to their same situation. So we're gonna work holistically with that person or that family in creating well-being all around them. So how do we help as social workers, or what do we focus on? One of the things we focus on is poverty. So we focus on poverty because we focus on those populations that either are underserved, have no voice, need advocacy. And the majority of the time where our clients are in that situation, they either need us to help them with either food, housing, health, accessing health. And that's one of the biggest things is we try to create access for health. We work a lot with individuals who are under stress, either because of the situation they're living in, or because actually they have too much stress through work, or any other situation that is bringing them to a mental health state where they're gonna need coping skills. And that's one of the things that social workers do. Graduate with your master's and you have a license, you can start working direct care or mental health. We're able to diagnose patients. Again, we don't only focus on the individual, but on all their history and their environment. And we're able to provide care or therapeutic care, whether it's individual, family, or in groups. We work with addictions. There is actually a license through counseling, which is the LADAX, which specializes in substance abuse. However, through social work, you also get trained to work with substance abuse and addictions. We work with populations that are abused from birth to death, basically. So since they're children, if they're going through abuse or neglect, all the way till the elderly or those who are sick in hospitals and are being abused. We work with disability, either doing advocacy, providing resources, doing case management. With physical illness, social workers also go into medical social work. So you will see social workers in the hospitals or in clinics. One of the newest things that we're doing through federal changes is integrated behavioral health. So social workers that are mental health providers are going into clinics in federal systems, which are normally FQHCs, federally qualified health systems. And we actually work together with the PCP. So we are their consultant. So instead of the doctor spending the time trying to figure out what is wrong with the environment of this person, or why is it that they are not on the medication because maybe they don't have access to it or they can't pay, as behavioralists come in and work with them. So for example, we may have an asthmatic that's having anxiety, and the doctor will ask us to come in and we will do breathing techniques with them to help them control their asthma. And discrimination, like I said to you, we are the voice for those who don't have a voice. So if someone is suffering discrimination in any level, we will be their advocate. You can find social workers in hospitals. They work in case management, either through billing or with billing, helping patients access care. Also making sure that patients can access resources once they're gonna leave the hospital. Social workers are in schools. That was one of my first jobs when I came back to Texas. In mental health agencies, depending on the level of license you have, you will be able to either do treatment with a patient or start doing assessment, and then someone with a higher level of license can sign off on the diagnosis or do direct care. We work in senior communities. Like I said to you, we do birth to death. So we cover all the different ages. And in senior communities, we work a lot with either the end of life, prepping the individual as well as the family to be ready for that moment, as well as accessing services and resources for the elderly. In government, a lot of us who do macro social work at government level. So social workers don't only focus on the direct care with the patient, but at some point, some of us grow into the macro, where we're not only gonna impact the individual, but we're writing policy, we're doing advocacy, and we're working in governmental environments trying to do macro change or change at the level of the communities. We do work on drug and alcohol facilities, again, providing direct services. We work in hospice, which is prepping people for the end of life. Family and children's services. There's many different things. There's intervention services to try to prevent families from needing a further or deeper service. And we also have protective services, which will be CPS or APS for the adults, and juvenile and adult correction programs.